If you're looking at Medigap Supplement Plan N, you're looking at a really good plan. You're only responsible for the Part B deductible of $203 in 2021. There is a $20 doctor copay that we'll discuss in a second, and there's a $50 ER copay. It's only if the emergency room visit does not result in an inpatient admission. We're going to go into that a little bit further. The Plan N offers the same identical coverage as the Plan G with just a couple of minor differences. Many refer to the Plan N as the Now Plan to Medicare. This plan has become very popular in recent years because it offers one of the least expensive monthly premiums compared to the Plan G and to the Plan F. Let's discuss the minor cost sharing on the Plan N that make it the Now Plan to Medicare and have a lower premium for those that are looking at Medigap supplement plans. See, an individual is responsible for the small Part B deductible of $203 in 2021, just like the Plan G. So apples to apples, the Plan G and the Plan are exactly the same because they're both, with both plans, you're responsible for the $203 deductible. Let's now discuss the $20 copay because there's a lot of misinformation about this. Only after the Part B deductible of $203 in 2021 has been met for that calendar year can doctors charge up to a $20 discretionary copay for an office visit. This copay cannot be charged for any preventative care visits. Let's now talk about the $50 copay for emergency room visits. An individual will also be responsible for a $50 copay for a trip to the emergency room that does not result in an inpatient admission to the hospital. If the individual is admitted, they will not be responsible for that $50 copay. Here at Healthcare Solutions Direct, we are seeing more individuals that are leaning towards the Plan N. The reason the Plan N is being called the Now Plan for Medigap is that on average, it will save someone about $30 in monthly premium over the Plan G. That's great news. This is a yearly savings of $360 or higher that an individual could save by agreeing to the small cost sharing of the copays for the doctor visits or the copay for the emergency care visit under the Plan N. To give this a little bit better of a perspective so that you understand it, an individual would need to go to a doctor and be charged the $20 discretionary copay almost 18 times, you heard me right, almost 18 times in 1 year to equal what they would have paid in premiums for that Plan G. And looking at the Medigap chart, you will notice that the Plan N will not cover something else called excess charges. This has been poorly explained by insurance agents, which has caused confusion that we're going to go ahead and clear up for you right now. Excess charges are extremely rare, as you'll soon learn, which makes this almost a non-discussion. In many states, it's not even permitted for doctors to actually even charge this. So what is an excess charge? If you're looking at the Medigap chart, you'll notice the Plan N does not cover excess charges. Medicare excess charges fall under the Part B medical of Medicare and are only for doctor visits. This will occur when a doctor does not accept what's called Medicare Assignment. So what is Medicare Assignment? See, if a doctor chooses not to accept Medicare Assignment, it means that they don't agree with what Medicare will pay them for that doctor visit. Doctors who do not accept Medicare Assignment are allowed to charge 15% more than what Medicare will pay them. This is called an excess charge. That 15% that Medicare excess charges are allowed to charge has been very, very misunderstood. See, it's estimated that over 96% of doctors and physicians do actually accept Medicare's assignment. They do accept Medicare's pricing. It benefits the doctor to actually accept Medicare's assignment because they'll be paid 100% of Medicare's approved amount. Those doctors that choose not to accept assignment, which is less than 4%, will only receive 95% of that approved amount. See, if a doctor chooses not to accept Medicare's approved amount, this means that they're going to receive 5% less reimbursement from Medicare. That doctor is now responsible for additional paperwork and billing to collect only an additional 10% for that doctor's visit. You can see now why very few doctors will choose not to actually accept Medicare's assignment. It's also illegal for any doctors to charge an excess charge for those that live in either Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, or Vermont. If you live in one of those states, doctors cannot even charge a Medicare excess charge. It's illegal for them to do that. See, the Plan F or the Plan G are the only two Medigap supplement plans that will cover the excess charge at 100%. Medigap supplement companies that offer the Plan F and the Plan G are responsible for any excess charges that are actually billed to them. To give you a better perspective, in August 2016, Aetna reported that 99.34% of their claims received did not have any excess charges that they needed to pay out. That means that only 0.066%, so less than 1%, had an excess charge that they were responsible for paying under either Medigap Plan F or Plan G, and they estimated the average was less than $20.